Good evening, everyone. Good evening, everyone, and welcome to COVID Conversations Moving Forward. I am Tanoa Morgan, Chair of the Distinguished Pearls Foundation, which is the 501c3 initiative of Zeta Phi Beta Sorority, Tau Delta Zeta Chapter. We welcome all of our esteemed guests, our community partners, and most of all, you, to this extraordinary event. The Distinguished Pearls Foundation and our partners have worked very hard to gather healthcare leaders from around the state for a frank discussion about what's next. We are here tonight, all of us, because we want to keep the people we love safe. And now that effective vaccines are available, it's time we talk about what we can do as a community to keep our loved ones safe and how we, as Black and Brown people in particular, can move past the devastation that COVID has wreaked on all of us and press on. Tonight is interactive, so I hope that all of you came with questions that you want answered and that you are able to leave this evening with information, good, solid information to share in your community. I want to thank each and every one of you online once again for being here and for being part of our conversation. And now it is my esteemed pleasure to introduce to you our partner and friend, President of Zeta Phi Beta Sorority, Tau Delta Zeta Chapter, Ms. Darkeisha Moten. Ms. Moten?
Thank you, Sora Morgan. Good evening, everyone. On behalf of Zeta Phi Beta Sorority Incorporated, Tau Delta Zeta Chapter, I bring you greetings and pray all is well with everyone. I would like to take this time to thank you for your time this evening, and thank you for the Distinguished Pearls Foundation and the Maryland State Vaccine Equity Taskforce for their invite tonight. It is my pleasure to introduce to you all the moderator for this evening's webinar, Minister Taraline Campbell. Minister Taraline Campbell is a resident of Prince George's County, Maryland, and is sought out as a keynote speaker and workshop facilitator for events, conferences, retreats, and other events. She is also a certified coach and author. Lastly, Minister Campbell is also a member of Zeta Phi Beta Sorority Incorporated, where she serves on the international level. It is my pleasure to turn it over to Minister Taraline Campbell. Thank you.
Minister Thank you, Sor Moten. Good evening, everyone. Happy Hump Day. I am excited about this event. Again, we are excited and we thank you for joining us tonight and for braving what is now known as the Zoom fatigue and logging on tonight because you want answers and because, as Tanoa said, you want to, we care about our community and about keeping one another safe. So I want to first and foremost, for my time tonight, acknowledge everyone who brought this event to, who pitched in to make this event happen tonight. Because it's really true that teamwork makes the dream work. And that's what tonight is an example of, is collaborative efforts. So the various entities that put this together for tonight include the Maryland Vaccine Equity Task Force. Also, of course, you heard from the Distinguished Pearls Foundation, which is the charitable nonprofit arm and entity of Zeta Phi Beta Sorority Incorporated Tau Delta Zeta Chapter. And I will say that we are excited as members of Zeta Phi Beta Sorority to be a part of this because the foundation's effort is to strengthen communities through outreach. And so this is an example of that. And then also tonight we have the Prince George's County Health Department, as well as the Charles County Health Department. So again, teamwork has made the dream work. And so with all of that, and we appreciate and applaud everyone in your respective places, let's get down to some good and healthy discussion. First up, I would like to introduce to you Dr. Diana Abney. Dr. Abney has recently returned as the health officer for Charles County Department of Health. She had previously worked at Children's National Hospital in the Pediatric Health Network She was the medical director for network management and was instrumental in the development of that network. Dr. Abney also has been very, very instrumental in the Charles County area and in her efforts to bring about, to address health disparities. One of her proudest accomplishments was bringing primary care back to Nanjemoy, and I know someone who lives in Nanjemoy, back to that area by opening a family medicine clinic in the community center. Dr. Abney received her undergraduate degree from the Massachusetts Institute of Technology and her medical degree from Tulane University School of Medicine. She is a board certified pediatrician who has practiced in Charles County for over 25 years. She is a professor at the University of Maryland School of Public Health in College Park. Let's welcome Dr. Abney. Dr. Abney, 1 second, you are muted.
I think I'm not muted anymore.
You're good now.
Okay, great. Thank you so much for that welcome. I'd like to welcome everyone to the webinar. I'm looking forward, and I hope you are also looking forward to our conversations about COVID. You are going to hear from 4 wonderful speakers who are going to give you a lot of great information about COVID vaccine, about COVID, the disease, and who will be willing to answer your questions, which you will hopefully put into the chat box. One of the most important things that I can say to you as part of my welcome is, it is most important that all of us get vaccinated for the COVID illness, and that the vaccine that you get is the most important thing that you can do. What you need to do is get whichever vaccine is offered to you at the time. And once you get your vaccine, we want you to talk to your friends and families and encourage them to get vaccinated also. I'm not going to spend a lot of time talking to you because I want you all to be able to listen to the wisdom that is going to be provided to you by our wonderful speakers. So at this time, I'm going to turn it over to the speakers so that they can give you all of the information that they're willing to give you tonight. Thank you so much for joining us, and please take in all of this good information and share it with your friends.
Thank you again, Dr. Abney. And yes, this is an evening where we have an opportunity to learn and to get answers. I know there has been so much information, and in some cases misinformation, that is circled around throughout our community. So this is such a great opportunity for you to ask questions. You can feel free to do so in the chat. Take in all of the information this evening so that you can really go back armed with information. Next up, we have Dr. Joseph Wright. He is Senior Vice President and Chief Medical Officer of the Capital Region Health within the University of Maryland Medical System. He previously served as Professor and Chair of Pediatrics at Howard University School of Medicine and as Senior Vice President within the Children's National Health System. There he provided strategic leadership for the organization's advocacy mission, public policy positions, and community partner initiatives. Dr. Wright is among the nation's original cohort of board-certified pediatric emergency physicians with scholarly interests that include injury prevention and needs of underserved communities. He has contributed over 100 publications to scientific literature and served more than 20 visiting professorships. He was a principal investigator of the NIH-funded DC Baltimore Research Center on Child Health Disparities. Let's welcome Dr. Joseph Wright.
Thank you so much for, first of all, convening this panel. It's great to join so many colleagues and friends this evening. And I'll just open with this remark. We're just finishing up our day of vaccinating. in partnership with the First Baptist Church of Glenarden. And I will acknowledge the support of General Burkhead, who is on this panel this evening, for the foresight to really identify the kind of partnerships that will encourage vaccine confidence at the community level. We've been at the First Baptist Church of Glenarden for about a month and have been vaccinating about 1,200 people a day. And just to echo my friend and colleague, Dr. Abney, the most important vaccine that you can get is the one that goes in your arm. So I'm looking forward to the conversation this evening. And again, thank you for inviting me to join.
Thank you so much, Dr. Wright. We definitely appreciate everything that you're doing. And I'm definitely, I live very close to First Baptist of Glenarden. I'm proud to say I got my second shot today and I am feeling great. So it is possible and we can proceed. We'd like to hear now from Dr. Rowling. Dr. Rowling is a highly trained and professional educator, a distinguished and notable medical doctor who has over 30 years of experience in environmental and biosafety protections and protocols. He is very passionate about his role as an infectious disease specialist. And we spoke with him before we began tonight, and I am sure he's going to bring a lot of energy as well as information to us. He has a medical degree from the University of Health Sciences in Antigua. He is a doctor of pediatric medicine, has a degree, doctorate of pediatric medicine from California College of Pediatric Medicine, and graduate degrees, master degrees in cellular and molecular biology from the University of Nevada, Reno School of Medicine. So now let's welcome Dr. Rowling. The floor is yours.
Good evening, everybody. It's a pleasure to be on this platform with distinguished doctors and people. And I think at the end of the day, folks, what it comes down to is trying to have what we call effective community education. How do we save African Americans? How do we save people's lives in this pandemic of the COVID-19 disease spectrum that's causing havoc throughout the world? My background as an infectious disease specialist and a trauma surgeon is that I've seen it. I've smelt it. I put people in body bags. I've operated on children that are 3 days old that have congenital defects that will blow your mind. I've done vaccination programs, real vaccination programs in the jungles of Peru for 20 years, up and down the Amazon, carrying 300 pounds of medication and vaccinating kids from everything from measles, mumps, rubellas. And I've seen children die that have not had diphtheria or tetanus. And I'm also a pathogenic virologist. I teach at the Heinrich Petite Institute in Germany. And I'm also certified in chemical and biological warfare by the US Army. And I did my residency training at Tripler. So when it comes to diseases, I think what's important on this COVID-19 is we have to have great medical and science information, not based off of people's feel goods, what you think. You cannot be a person drinking a cup of coffee in Idaho talking about a disease like the SARS virus, and you've never been out the country. You haven't dealt with Ebola. You haven't dealt with malaria, Zika, chikungunya. These diseases I deal with every day of my life for the last 30 years. So for what I think is important as we progress into this vaccine and everybody's pushing vaccine is that you have to realize, folks, the vaccine is just one small answer in the puzzle. While we've had the mistakes that we've had, while we have 560,000 Americans, it's probably higher than that are dead, and the numbers are going to increase because people were misinformed in the beginning. So what I say for this year, we have to reset the clock back. You got to go back to the basic. You got to be able to talk to Big Mama in the Mississippi Delta. You got to explain to folks what are we dealing with, and nobody's taking the time to do that. I've done it on MSNBC. I've done it on multiple hundreds of platforms, telling people we got to get back to the basics. The basic, folks, the SARS virus is an RNA virus. Folks, it came from an animal. The virus mutates every 2 weeks. There's over 4,000 different SARS variants off of the D61 strain from Wuhan from last year. And guess what, folks? The virus is getting stronger. You have the India mutation, you have the Brazil mutation, you have what's happening in Europe. I can go on and on and on. This is what we have to understand, and you folks out there need to make sure that you're looking at the science of medicine. I can tell you what's going to happen in the United States within 1 month, guaranteed. But look at what's happening in Brazil. People are dying. India, people are dying. They cannot keep up the bodies that are burning in the crematoriums because there's too many people dying. What's happening in Italy, what's happening in London comes to the United States about a month later. So how are we going to get through this is that we're going to have great basic biosafety, biosecurity protocols. People are talking about vaccines. That's great. But how do we really know if the vaccines are working in the population? Did they do a rapid antibody test on you when you took the test and they showed you that you were exposed or not exposed? Did they give you the rapid antibody test 3 months, 6 months, 9 months to a year? That is how you know that the antibodies are being developed by the vaccine that you take. Doesn't matter if it's Johnson & Johnson, Moderna, J&J. The reality is that you have to know what the community infection rate is, and that's what we really truly call herd immunity. Herd immunity is through 90% of the population. It's based off of vaccination. People got immunity to it, natural selection. If we do not understand this concept, vaccine platform, education, rapid antibody test, to actually say, hey, Ms. Jones, or Big Mama, we give you the injection tomorrow. In 21 days, we measure antibodies and we see what your antibodies are. Are these antibodies long-lasting, short-term? In reality, right now, they're short-term. So we need to know that, because everybody that gets a vaccine, no matter what platform it is, you will be getting 2, 3, 4 boosters a year for the next 50 years. This virus is not going away. You can't put your head in a microwave. You can't drink Clorox. The virus is the virus. Thank you very much, folks.
Wow. Thank you, Dr. Rowling. That was the voice of knowledge and keeping it real. Thank you so much for that information. We really appreciate it. Miss
Thank you very much. And
yes, go ahead.
Thank you very much. And thank you very much. I hope this is a good platform to start, because the way we save people's lives, folks, is based off of medicine and science, period. Not a feel good, what I think, because when you think, that gets people killed.
Yes. Again, thank you. Thank you. We appreciate you, Dr. Lane Rowling, for taking your time out of your busy schedule to share that, as you said, keeping it real. We do need to keep it real, and we do need to have the knowledge in order to do that. Next up, Miss Janine Richmond. Miss Richmond is president of Luminous Health Doctors Community Medical Center in Lanham, Maryland. She has more than 25 years of experience in healthcare operations, population health, clinical operations management, and healthcare policy. Prior to her role as president, Ms. Richmond served as the chief quality, patient and safety and population health officer for Luminous Health. And before then, she was the vice president of population health and clinical improvement at Anne Arundel Medical Center. Ms. Richmond holds a bachelor's degree in nursing from the University of the District of Columbia and a master's degree in healthcare administration from the George Washington University. She is an adjunct professor at the George Washington University and recipient of the Millikan School of Public Health Excellence in Teaching Master's Level Online Award. Let's welcome Ms. Janine Richmond.
Hi, good evening. I'm so happy to be here. And I'm just going to take a couple of minutes and share a few comments from a community perspective. And, you know, right now, and I can tell you as someone who has been living through this pandemic and seeing how it's ravaged our community for over the last year now. And when we look at who's being impacted, we know that when in our Black and Latinx communities, that we have been overrepresented in number of cases. We have been overrepresented in number of hospitalizations. We have been overrepresented in number of deaths from COVID. Yet, as we are now offering vaccines, we find ourselves underrepresented. So that is an equation that we need to flip on its head. And we have to really ask ourselves, why is it that Blacks and Hispanic individuals are getting vaccine shots at a lower level, a lower rate than white Americans? And I think that there's a lot of different reasons for that. And I'm only going to quickly just talk about a few, because what I think we really need to spend our time talking about is, how do we address it? What are the solutions? So I am a glass half full person, very solution oriented. And I think that's where we should really be spending our time. But in order to have solutions, we need to understand where are the concerns. And we know where some of those concerns are. And some of the speakers prior to me have talked about it. And I'm sure some of the other panelists will talk in more detail about it. So we hear things and we know people have concerns about side effects of the vaccine. And we have to realize that for certain segments of the population, particularly those who we especially need to reach, that's a real issue. It's not because they don't trust the science or believe in the science, but they're worried about, am I going to miss work because I'm not going to feel well the next day? And for some of us, it may be, maybe your salary, maybe you could call in and, say, hey, I'm not feeling well today, I'm not going to make it. But what about the people who don't have those types of jobs and occupations? What about those people who are paid by the hour, who may not have benefits and will not get paid if they have to leave work? What about if they can't even find a vaccine clinic that's open during the hours that they are not working? So once again, they don't have the time to sit on a computer for 4 or 5 hours and look for an appointment, or even to say, I'm going to take an hour and go to, whatever community site is offering these vaccines. So we have to think about that from access. So we have access as far as people's ability to get the vaccine. We have access issues as far as people's ability to get accurate information. I am a news junkie, but I have to realize that not everybody is looking at CNN. Not everybody is going to the health department website or to my health system's website. So if that's where most of the information is, then they aren't even getting the information they need to make an informed choice, let alone to know how to navigate registering for the vaccine and where to go to get it. So we have to make sure that we are providing people access to accurate information, access to the vaccine. That could mean making sure we're addressing things like transportation, making sure that we are offering the vaccines in places where they trust. You heard my colleague, Dr. Wright, talk about, that he's been at First Baptist Church of Glenarden. People sometimes are more comfortable going to a church or a community organization, or even to their local hospital to get the vaccine, than going to what I've heard some people say, a government site. Now it's the same vaccine, that we're giving in all of these locations. But once again, we have to be willing to meet people where they are. And if they have a mistrust of the government or mistrust even of a healthcare system, but they trust their pastor and their church members, and they're more willing to go there, then we need to make sure that we can offer it there. So that's a lot of the work that we've been doing when I now want to just take a minute or two and talk about solutions. So one, we need to offer vaccines in the communities that we are trying to reach. This isn't about saying, come to us. This is about, we need to go to them and make it accessible. So at my hospital, for example, we are now running 3 community-based vaccine sites. One at First United Methodist Church of Hyattsville, which is one of the hardest hit areas in Prince George's County. We know Prince George's County as a whole has been hardest hit in Maryland, and that Hyattsville area has been the hardest hit within the county. We have a site at Reed Temple AME in Glendale, Maryland. And what I love about that is that the pastor, first of all, got his vaccine first, came to our hospital boardroom when we had first opened it up to the community and received his vaccine first, posted all about it and went to his congregation and to the other AME and other denominations and talked about it. And then opened up his doors and is allowing us to be there so that people can come there to get his vaccine. So that's what I'm talking about. We're talking about people who are walking the walk and not just all talk. That Pastor Whitlock is a perfect example of that in the way that he's been leading. And then we have a center at vaccine center at Prince George's Community College, which has been awesome as far as reaching that community, including our younger folks who are now eligible to get the vaccine. So we need to go where people are. For our most vulnerable, we even need to make it easier and go directly to them. We have a mobile effort where we reach out to the most vulnerable members of our population and literally go directly to them. We need to put information out there where people are likely to see it. So maybe it's not CNN, maybe it's, a popular local radio station or other ways that we need to get information out there. We need to leverage our trusted voices in the community, including our faith-based leaders and other community leaders. We need to meet people where they are and answer their questions. So I don't talk about vaccine hesitancy. I like to talk about what is it going to take to address people's concerns and get them to accept the vaccine. And there have been lots of studies that have been done that show that when people receive information and get their questions answered, that they are much, much more likely. And we see it in the data where people who were hard-nosed may have moved to the wait and see, and there's a segment of them that have now received their vaccine. And that's what we just need to be patient and continue to do. And the last thing I want to end with is just what I call speaking to people's why. So we all have reasons and our motivation as to why we want to get the vaccine. For me, as I share with people, it's really all about getting back to my life with my family. I don't want to spend another Thanksgiving or Christmas on Zoom. I want to be with my family all together. I want to have the family gatherings. I want to travel and go on vacation. And I want to make sure that others have those opportunities to do that. And I want to make sure I'm doing my part to protect some of my most vulnerable family members from getting ill. So I think if we take time and speak to people's why it's important to them, what they're gaining from the vaccine, what it's going to allow them to get back to doing, get back to their lives, get our kids back to school and back out on the, on their sports teams and all of those other things, we can all reflect on and speak to our why and focus on those things. So that's what I'm hoping, is that we continue to focus on solutions, we continue to meet people where they are, and we continue to make it super, super easy for people to get the vaccine when they are ready and providing them that information that's going to allow them to get there. So thank you for allowing me to share.
Thank you so much, Ms. Richmond, for that wealth of information and for giving us some actionable steps, some takeaways in case you are, anyone is taking notes. I heard overrepresented in certain areas and then underrepresented as it relates to the vaccine. And then I heard some actionable steps in terms of access, assisting one another, our fellow citizens with getting access, partnering up, sharing valuable information, which is what we're doing tonight. So thank you so much for sharing with us steps that we as individuals can take and as we work through this situation, because I think we all agree we don't want to spend the holiday season on Zoom again in 2021. I next want to bring back Dr. Ernest Carter. I see you're listed up again. So Dr. Carter.
Okay, thank you very much. So I'm so grateful I'm here, and thank you so much for the Zetas for making this possible. I really appreciate the effort that's been gone into it. I'd like to thank President Richmond, who just talked. She is a valuable member to our effort. She's really taken the leadership and really got into community, worked with us very, very closely. And also Dr. Wright, who came on. He has taken the University of Maryland medical system to a new height, and he's been a great partner to us. And General Burkhead, who's going to come on, and the Vaccine Equity Task Force, they really helped us in Prince George's County, making sure we get to an equitable position. And that's so important to us. And it's always a pleasure to be with Dr. Abney. She's a friend, and she's a teammate in this effort moving forward as a health officer. Just to tell you a little bit about the COVID cases that we have in Prince George's County, they're still high in Prince George's County and in the region. Prince George's County remains about 1,200 cases a week for the past 3 weeks. And our positivity rate, and that tells you how many people, would test positive. The percentage of people who test positive have been around 5%. Now, we like that to be less than 5%. We really like for it to be less than 3%. That positivity rate tells us a lot about how the virus is spreading, as well as the infection rate, which is for us about a little bit above 1. And what we would like to do is get those numbers way down. We also look at our hospitalizations, how many people have gotten the virus and end up in the hospital. And one of the things is that it's starting to decline, but it's still in Prince George's County, there's about 140 people get hospitalized a week in Prince George's County. That's still way too high. Not way too high, but too high. But there's some light at the end of the tunnel. We're seeing the trends start to level off. But what that means for the virus is that the virus has peaked and then it goes down. And when the summer comes and the humidity drops, it goes down a little further and it stays a little bit dormant. And then, like the flu virus, it comes right back up. And that's going to happen over and over again with this virus. So number one, in order to get it way down so that we can really get to where President Richmond said we want to be, so we can hug and kiss people and go and see people and do the things we normally like to do, we got to get a lot of folks vaccinated. You got to get people vaccinated so that the virus can't spread so fast. And right now, it's still spreading at a nice little clip, not too high, but it's spreading. And if we don't get enough people vaccinated, it'll continue to spread. And then when it gets ready when the fall and winter comes, it really will spike. And then we'll be back, into having the mask, and, it'll really get crazy again. So what we want to be cognizant of is that everybody who can get vaccinated should get vaccinated. Getting vaccinated is a very, 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 very safe thing to do. And it's going to protect you, and it's going to protect your loved ones. It's the most important thing you do now. Right now, we don't have, like the flu, we have an antiviral for the flu. So, you can go get their Tamiflu and et cetera. But the COVID virus doesn't have that. And all we have is distancing, wearing masks, washing surfaces, and getting vaccinated. Now, if we go ahead and get vaccinated, there's a lot of folks have to get vaccinated. It's probably 80 to 90% of the population needs to be vaccinated. We can get to 65%, we're in good shape, but we want to get to very close to as many people vaccinated as you can, because then the virus can't spread as much. And you get vaccinated, and then of course you're going to have to get a booster, because it's going to be just like any other virus that you have like this. Your immunity will wear down over time. You're going to need a booster almost every year. So you might as well get used to this now. This COVID virus is very lethal. It's not the reason I say it's very lethal, because it will attack your lungs, your heart, and your kidney. And last thing you need is a virus going through your body like that. Now, of course, as you know, a lot of people got the virus and they feel very good. And most people who get the virus, it's not going to kill you. But it kills enough people that we can't afford for that to happen anymore. We, as a society, as people, and as African Americans who who are very susceptible to this, we've got to protect ourselves and our loved ones. You got to do it now. It's no time to worry about whether or not, oh, is this going to give me something down the road? Well, millions and millions of people have gotten a Pfizer, gotten a Moderna, have gotten a Johnson & Johnson, and absolutely nothing has happened to them. And, you know, studies that have involved African Americans in the past have happened where they have withheld, you know, the treatment from African Americans. Now they're offering, we've got to take this. The science that is out there for the vaccine, that the current vaccines are out there, is really good science. The vaccines, the Moderna and the Pfizer vaccines are revolutionary technology. And these vaccines are extraordinarily safe. I haven't seen a vaccine come out like this that is safe at 95% efficacy like this. And I think what you're going to find is that you get the vaccine and yeah, your arm will hurt a little bit. You may have some symptoms, like you may feel a little achy, you'll have a little congestion. Some people have absolutely nothing and it'll go away after about 48 hours and that's it. And if you take a little Tylenol after you get your shot, and you know, and maybe you'll have to sleep a little harder that night, but it goes, and next thing you know, you're immunized. And so that's what you want. And we're going to get to the point where we're going to be there. Right now in our county, we've got about a quarter of the county population has been fully vaccinated. The people from 16 and older have been fully vaccinated. And I want to thank every living soul who's gone in there and got that vaccine. People in Prince George's County, the people in Charles County, people in the region, everybody who's gotten that, you deserve a medal because you're protecting the folks here. We've made great progress on these vaccinations, and I just want to be sure everybody knows we got to keep our feet on the gas. This is no time to let up. We got to be sure while we're still not completely safe, we've got to wear our mask and stay at 6 feet distance until we can get every single soul that we possibly can vaccinated. We've got a fantastic team of folks out there helping us get these vaccinations done, including General Burkhead, who's helped us tremendously, as well as the partners you've seen on the webinar so far. So I'd like to thank everybody. I really am appreciative of having you guys have me on tonight. I'd like to thank our teammates and our whole public health effort. So at this time, I'll turn it right back over to you.
Thank you, Dr. Carter, for sharing, again, a wealth of information. And I feel like I'm sounding like a broken record, but wealth of information and challenging us to not let up. And as you said, keep our foot on the gas, so to speak, as it relates to this vaccine and to addressing COVID. Thank you so much, sir. Without further ado, it gives me great pleasure now to bring to the virtual stage a presentation on behalf of the Maryland Equity Task Force, Brigadier General Janine Burkhead. So pleased to introduce her this evening. She received her commission as a distinguished military graduate of the Reserve Officers Training Corps at Hampton University. She completed the Chemical Officer Basic course and served 3 years in the U.S. Army Reserves. In 1994, she received an appointment to the Maryland Army National Guard in the 29th Support Center, and later as aide-de-camp to the Adjutant General. She is commanded at the company, battalion, and brigade levels. She was mobilized in support of OEF/OIF 2004 and 2005, serving as the Tiger Team Leader and designated military officer for the Office of Administrative Review for the detention of enemy combatants. Brigadier General Burkhead simultaneously commanded the MDARNG and Task Force Capital following the attack on the nation's capital through the 59th presidential inauguration. Maryland Governor Hogan appointed Brigadier General Burkhead to lead Maryland's COVID-19 vaccine equity task force in January of this year. She is also the Deputy Commanding General, Reserve Affairs at the United States Army War College. Let's welcome General Janine Burkhead.
Hi, good evening. Glad to be with you tonight and so many of my partners working to bring an end to this COVID-19. The task force was set up to partner with local health departments and community stakeholders to bridge the health outcome divide throughout the state of Maryland and to increase the access to the vaccine. And we work together with our local, federal, state, and community partners and private organizations to reach the underserved communities. Now, the Vaccine Equity Task Force, next slide, please. The Vaccine Equity Task, next slide. Yes, here's our process. So the Vaccine Equity Task Force has a 7-step process. And I think it's important just to give you an overview so you know what we've been working on and how we operate in the field. We have community outreach team that goes out, meets with people where they are in their communities. And out of that outreach may come a proposal. And that proposal is in depth and it determines what that community might need to actually run a clinic or whether it's information that they need. And once that proposal is received and reviewed, there's a site assessment. And it's important to note that we have logistics and medical specialists who run that site assessment because we want the community to feel that they are empowered to make this happen where they are, but also that they feel comfortable that professionals are out in their community providing them with the appropriate amount of advice. And then we move on to step 4, where we actually develop a plan. And then again, some communities run a little bit faster, like when we stood up and helped Reed Temple, very quick process, you know, that we were able to move very quickly with the help of Janine Richmond and her crew, and with Pastor Whitlock and all the professionals in the church family. And then we came in, we're able to set that up, review the proposal, and actually start to provide vaccine on site in the community. There are in some instances, we're not able to move that quickly and we have to find partners. And in that way, we're partnering with the Safeways or the Wegmans or other ones like Safeway, CVS or Rite Aid. So we have several partnerships across the state where we can bring those partners to bear. The beautiful part about that is that increases vaccine in your community when we're able to partner that way, because there are federal programs and there are state programs. And then with the Equity Task Force, when we're in support, many times we're able to bring to bear additional vaccine to the community. So those partnership efforts are also go hand in hand with the Maryland Department of Health, the local health departments, and community organizations. It's also important to note that on the next slide shows you our methodology. And it was important that we be consistent and intentional. Another panelist mentioned about working in the community where they are, meet people where they are. How do we determine who those people are? Well, this is our methodology, and we stick to this, and it has actually shown results. So we're looking at the vulnerability indexes, the census data, the American Community Survey data, the CRISP data, ESRI, which is our mapping, and then the area deprivation index. And we take all those, bring them together to come up with a Maryland-specific composite that then we lay over a map, and it tells us what zip codes we need to focus on. And as many of you know, those zip codes may be in one of your neighborhoods, and you may have seen us there either conducting a clinic or bringing our mobile van there. And that's important that we establish partnerships in the community to build that trust. And we realize that's what works for us best. And as we see the numbers of vaccine actually going up and the numbers of people getting vaccine and those slowing down at our mass vac sites, we realize that mass vax is not for everyone. And so that's why it's important that we continue to have these clinics in our local communities and making people feel comfortable. One of the other panel members also mentioned the health disparity that we've had laid bare by this pandemic. And this is one of the things that the Vaccine Equity Task Force wants to do, is make sure we're doing no harm. At the same time, we want to make sure that we're empowering a community to feel that if there's a booster shot, or if there's another health equity event that needs to happen, that they feel comfortable enough to be able to run these sites and do it because professionals have come out that they're comfortable with, people that they trust, and say, you can do this and help your own community. And we do this in a way where we are showing actual competency in being paying attention to whether it's a community that's hesitant to have a certain demographic in their community, or whether it's coming in a military uniform, or whether we are showing competency by bringing interpreters in who speak different languages, or whether we're showing competency by bringing in material that's in several different languages. And we have several different tools, and we understand that there's not a one size fits all. Next slide. So at a glance, these are some of the things, some of our metrics just at a glance, but we've contacted all 24 jurisdictions in Maryland, and we have actually performed and run missions in all 24 jurisdictions. And those missions may be a clinic where we've actually performed as the National Guard and our mobile vaccine teams, or we may have partnered with one of the clinical partners, or a clinical partner may have just come in with vaccine that we provided, and they will continue to run those missions. And so we continue to review proposals. We continue to do site assessments every day. Today, actually, we ran 9 events today across the state, and we will continue to do that. Over the next 30 days, we actually have 11 well-mobile missions running across the state. Next slide, please. And with the well-mobile, this is what it looks like. It is actually a vehicle that we were able to obtain from the University of Maryland medical system. And they had never been used for this or anything else. They'd been sitting and idle. And we thought this is a perfect way to use these. So we can conduct missions with these mobile vacs. We can actually open it up and bring patients through, or we can actually just pop it up and have people outside run a mission that's a pop-up mission, or we can use an indoor-outdoor hybrid model. The beauty of this is that we're coming with iPads, and we're coming with the ability to actually give you the shot, and then just like any other clinic, schedule your second visit if we need to. And then also with the walk-up, drive-in capacity that we have, we're able to get into underserved populations all across the state, and we're able to get into areas that are hard to reach at a moment's notice. And we have found that this has been very helpful in our mission to get the vaccine out. So those are a few of the things that the Vaccine Equity Task Force is tasked with doing. I've appreciated the partnership and working with the various members of the community, working with the actual health department and the health officers, and then meeting so many different organizations. Last week or 2 weeks ago, we worked with Prince George's County and Charles County to conduct a clinic together with the Piscataway Kanoe tribe. And you talk about being in your community, in their backyard, making people feel comfortable. And you may have heard today on the press conference with the governor, we're actually going to open up a site at Morgan State University, and we will run 3 days out of Morgan conducting vaccine, not only for the students and the faculty, but also for the community. And then we'll also be conducting a vaccine at Bowie State with our mobile vacs. So we're really excited about some of the things that we're doing to ensure that there's community immunity. We know that it takes a certain number to get to that herd immunity point, and we want to do our part to make sure that that happens in Maryland as soon as possible to get back to normal. So thank you for putting this on and being with me this evening, and I hope you got something out of it.
Thank you so very much, General Burkhead. Thank you for all that you are doing on behalf of Marylanders. This has been phenomenal. If you have questions, now is the time for you to share those in the chat. I'll give you a moment to type any questions that you may have in the chat, and we will pose those to our very knowledgeable and quite capable presenters for this evening. We have heard again from Charles County, from Prince George's County, all the way up to the state of Maryland's Vaccine Equity Task Force. It can't get any better than that. And I'll take a point of personal privilege, as we say in Robert's Rules of Order, and say that I'm also super excited that with this event, we also are hearing from people who understand the concerns, if you will, of the minority community, of Black and Brown people. And I think that I believe it was Miss Richmond and Dr. Rowling perhaps that alluded to the fact that that is also it's important, because there are certain concerns that our communities have that may lead to either get the vaccine or not. And so having this COVID conversation, this conversation with the community is so important for us to do so that we can move forward. Any questions? Let's see, any questions in the chat?
Yes, Terraline, we have a few questions. So some people had submitted some in advance as well. So we have, in reference to the Johnson & Johnson vaccine, can you tell us about the pause, and should we be scared to take the vaccine? Any panelist or speaker can answer.
Well, I think it's, I'll take that. I think it's important to folks to understand that these are going to be, these vaccines, especially the Johnson & Johnson experimental use authorization. That means that we're figuring out what's happening. And so this might be one of the adverse effects that this vaccine has on people with a thrombocytic effect. In fact, here in Nevada, Las Vegas, we had a girl that had the Johnson & Johnson vaccine. She's on her third brain surgery to remove the clots out of her brain. So that's why you need to make sure that everybody that's getting these vaccinations, that you're informed and you feel comfortable about it. And for example, you know, I've talked about this on the Black News Channel and different platforms, is that as we're getting the vaccine for our people, for African Americans and minorities, we need to make sure that we understand what the disease burden is in the population. For example, 1 in 350 Black folks have sickle cell trait disease. What are the effects of somebody getting the vaccination? Is there an adverse effect when you get into a crisis and stuff? So these are the questions that we have to ask ourselves as we go down this line and vaccinating everybody, trying to get to that magical 90% herd immunity. People need to understand what herd immunity really is. Herd immunity is, by definition in the world of virology, is when 90% of the population gets is immune through two mechanisms. One, through vaccines, you have immunity, and the other 10% of the people are protected, or you get it through natural selection. People get infected by the virus, et cetera. That is the ultimate goal of any viral program or vaccination program, is to get to that herd immunity to protect people. And that is where we have to have great medicine and science that is backed up with the information that people are talking about, especially when it comes to vaccines, because you will, and there were people that will get Bell's palsy. There were people that get Guillain-Barré syndrome. There were people that will have reactions and die, et cetera. But we need to make sure that the decision to get the vaccine is based off of informed consent, and trying to make sure that Black folks have a confidence in the vaccine. And we can talk about the Tuskegee syphilis experiment. We can talk about Dr. Sims cutting out Black females' vaginals without anesthesia in Alabama. We can go down the list of the history of what people have done and why people of color have a, you know, kind of a really don't believe it. So we have to have people that look like us, be effective communicators, the general, Dr. Carter, everybody, based off of science and medicine, and that good old Big Mama, understands what we're talking about.
If someone receives the J&J vaccine and later, maybe in a few months, can they get another vaccine that may be a little more potent?
Well, I wouldn't say more potent than what they can do. And this is the reality, folks, and we're not here to sugarcoat it. Sugarcoat gets you injured. The reality, I don't care what vaccine is, Pfizer, Moderna, J&J, AstraZeneca, we can go down the line. And I'm working on 2 vaccines that are coming into the future. I'm on the science advisor panel, is that you will be getting a booster. Doesn't matter if it's Pfizer, if it's Moderna, J&J, you will be getting a booster shot once or twice a year for the next 50 years. The president of Pfizer said it 2 days ago. Fauci said it on Sunday. even though you get vaccine, folks, there is no long-term or short-term immunity to the vaccine. The vaccine's antibodies last about 81 days. So you're going to have to get a booster. That's just the reality.
Okay.
So Nisi, this is Dr. Abney. Nisi,
I'm sorry.
this is Dr. Abney.
Oh, hi, Doctor.
Can I go back to the first one about Johnson & Johnson?
Yes, please.
So the first one that I want to say is that we are lucky that we live in a country that actually monitors what's going on. So you know that there were about really close to 7 million doses that were given. And with knowledge of 6 cases, from watching what's going on and taking reports and actually paying attention to reports, they said, let's stop, let's look, let's investigate, let's see what's happening. So that is something I think that people need to understand and need to take into account, that they didn't just say, oh, well, let's just keep going like we were, but let's take a pause, let's look at this, let's compare it to what the natural course of that particular event is. How often does it happen with or without vaccines? And compare it to see whether or not we need to stop completely, or is it going to be safe to continue? So while we're in this pause, what they're doing is they're just not sitting twiddling their thumbs. They're actually looking at this, as Dr. Rowling said, they're looking at the science and they're making data-informed decisions about whether it is safe for us to continue to use that vaccine. And that is something that the FDA and the CDC does with all vaccines, not just with COVID-19 vaccine. They've done it with the DTP and all the baby vaccines, the children's vaccines we've given, and the other vaccines that we will be developing in the future. So we do have to at least be thankful that we live in a country where our vaccines and other medicines also are monitored and watched even after they're starting to be given. In fact, people are monitored and people are studied for years after a vaccine is actually given permission to be used. And not just emergency use authorization, which is what we have now, but after they're fully approved, that still continues.
Okay.
And this is Dr. Carter, just real quick to back on what Diana said, is that this Friday is when the Advisory Committee on Immunization and Practices, the ACIP, this is when they're going to meet. Those are the top scientists in the country around immunizations, and they're going to take a deep dive, as Diana said, and we're going to be looking to see what their report is, and that's why that pause is there, because they really do take a very strong look at it, and as she said, we're lucky to be in a country that does that type of science and is that careful. So for folks who've already had the vaccine, you're in good shape. It's no problem. I mean, 1 in a million, you're in good shape. You don't need anything right now. You're going to need a booster later on, but everybody's going to need a booster later on. So I think I just wanted to second what Diana said, because what she said is absolutely correct.
And full disclosure, my daughter, who is between the ages of 18 and 48, received Johnson & Johnson vaccine and is doing fine. And she's a scientist. And I asked her and her brother, who's a biology scientist, who's studying for a PhD in biology, I asked them, I said, are you concerned? And actually my son came to me when it first was announced. And he said, Mommy, let's just do the math. Look at the math. And we asked my daughter if she was concerned, and she was like, no, we did the math, you know? And given the choice of having this vaccine, which has this very small chance of maybe giving me a problem, and getting COVID-19, which we know has hospitalized and also killed so many people, I'm happy with my choice. And this was my daughter's words.
Yeah, and I have to say that my daughter has deep vein thrombosis from flying in the airplane too long, and she had to eventually get on anticoagulants. But we didn't hesitate for her to go get the vaccine, because we knew that you have to do the math. I'd rather protect her against this virus, which I know can attack, her vital organs, and she could spread it. I'd rather her get vaccinated, and she's been vaccinated, as opposed to not have it. So, so Diana and I have we have mutual understandings about this. We tell our children the same thing, and we don't do anything in our family that we won't tell you all to do. That's one thing for sure. We took the vaccine. We tell our children, our grandparents, and everybody else to make sure you get vaccinated, because we understand the significance of it. And as health officers, and I feel good about being a health officer with Diana, because we're synergistic on all this stuff. We're making sure that our folks in this region get vaccinated.
Awesome. So
It's very important. I think it's very important that everybody gets vaccinated. But like you say, as the science and medicine becomes more readily available in a vaccine that's just very, very new, we need to make sure that we keep people informed. You know, for example, the Johnson vaccine has a 10% vaccine effectiveness against the South African strain, which means it doesn't do anything. You have to realize that for every new variant mutation, we're going to have to come up with a different vaccine platform from that. And that's why the people need to understand that this is not a short-term gain. This is a long-term gain, and that we're going to be doing this for the next 50 years. That's the reality of the SARS-CoV virus, period. That's just virology. No ifs, ands, buts about it.
Oh, wow. So it's here to stay. Vaccines. Okay. So someone asked.
Oh, absolutely.
Okay. Someone covered this a little bit earlier, but are there any tips for reducing soreness at the site of the injection or to minimize side effects from the vaccine?
So one of the things
I mean, Dr. Carter said it.
Go on, I'm sorry.
You can take Tylenol. You can take Tylenol. You can put an ice pack on the vaccine site. That's anytime you get vaccinated on a vaccine, vaccinated from a virus and stuff, you're going to have an inflammation reaction. That is part of the mechanism of action to stimulate your body to start producing B and T cells and memory cells. So that is one of the primary effects that you're going to have. And the second thing is that nobody knows who's going to have a different adverse effects to the virus. Some people are going to have multi-inflammatory syndrome. Some going to have Guillain-Barré syndrome. Every person's different. That's the reality.
Yeah, and as a pediatrician, I give lots of vaccines, and he's exactly right. We tell people that if it bothers them, they can use an like a cool compress. We also tell people, move your arm around a little bit. That sometimes seems to help also. And then the other thing is exactly as he said, when you're having those discomfort type things, what your body is doing, it is learning how to fight off what we're teaching it how to fight off. So it's actually, if you look at it on a positive light, it's doing what it's supposed to do. And that is a little bit of why the second one sometimes is, people sometimes have a little more reaction to the second one. And they say, oh, I didn't feel the first one at all, but you know, I got a little bit of fever and I was a little tired with the second one. But just think of that as your immune system is saying, aha, I know what to do with this. And I'm going and I'm making more antibodies. So just, you know, ride through it. And it is really true that most people are over that in about somewhere between 24 and about 72 hours. My poor family gets dragged into conversations all the time. My husband had a headache and he woke up in almost exactly after about 72 hours. And he said, oh, my headache's gone. And I said, I told you, 2 to 3 days.
Okay. So there's a question about the age of the people who are getting, who are being hospitalized. So like in the beginning, it was older individuals. And so they were prioritized to be vaccinated during the pandemic. But now it seems like it's younger people being hospitalized and getting really sick. Can you guys discuss that? Is it a variant? What's happening?
So I'll just jump in, and I'm not going to allow my physician colleagues to get into the scientific piece, but I can speak to what we are seeing at my hospital and what I know others are seeing, not just in Prince George's County, but around the state and the country. So you're exactly right. Last spring this time, it was more of an older population. Lots of, a large number of people we were seeing who required hospitalization were people from nursing homes or other people who were older and had other chronic diseases that made them more symptomatic when the virus, in the way that the virus impacted them. So they were having more of those symptoms that required them to need the type of care and treatment that we can provide in hospitals. The good news, I would say now, and I think this speaks to the benefit we're seeing from the vaccine, is that you all remember just a few months ago, first it was you had to be 75 and older, and then 65 and older, and we were vaccinating nursing home residents early on in the state of Maryland and across the country. And guess what? Those aren't the folks we're seeing by and large who are in the hospital. So what we do know from the vaccines, and I see it every single day, is that it's preventing them from getting severe illness, and they are no longer the ones that are in all of our hospital beds and in our critical care or intensive care units. We are seeing more of the age has shifted, I would say, in the last couple of months. So we are seeing the age shifting down some. And I think some of that is because, one, we're now looking at people who have not been vaccinated. Two, we all know that people are dealing with COVID fatigue. So people are beginning to let their guard down. I think it was Dr. Carter who said, we talk about the 3 W's: wear your mask, wash your hands, watch your distance. Those things are still so important for us to do. So, people who are starting to have gatherings again, hanging out more now that the weather is getting warmer and other things. And, oh, by the way, some of these younger folks have underlying health conditions that are making them more likely to get sick and require the hospitalization. So I think it's so important that as more and more people are getting vaccinated, that we recognize that we still can't let our guard down, because I don't want to see you in my hospital bed. And I would much rather see you get the vaccine. I think it was Dr. Abney and Dr. Carter and others said, just do the math. And if you look at the math, think about those who may play the lottery or something, that 1 in a million, which are people who are getting severe side effects, 1 in a million, right? That's like playing the Powerball and waiting for it to come around, versus we know that over 500,000 people have died. We know over 32 million people have been infected. So do the math and think about which group do you want to be in. I love that, do the math, because it really is all about that.
Well, that's excellent. But let me get to what the question was. It says, why are we seeing the cases in younger people? Well, I was on a platform yesterday, 2-year-old baby got COVID in Atlanta. The reality, folks, is that this is driven by the Brazil strain P1, P2, the B117 London strain, the South African strain, and the Indian mutation. All these mutations are driving this new infection rate. People that were infected last year is based off of the D614G, which is a Wuhan strain. This virus is mutated into much more lethal, much more transmissibility. And as the Brazil strain gets more common in the United States with the London strain and the double mutation strain from India, you're going to see a whole bunch of people infected, from babies up to 80 years of age. That's why it's important that when we do have a vaccine program that's effective, that vaccine has to be what we call vaccine effectiveness, not vaccine efficacy. People say the vaccine Moderna is 80% efficacy. That has nothing to do when you put that vaccine in this real world and you start injecting people with sickle cell, people that have autism, mothers that are pregnant, etc. The science will catch up with that, but the reason why you're seeing it more in children is because of the variants, the mutations from Brazil, India, London. You can look that up on the news. Thank you very much.
Okay, we have a lot of questions about antibodies. So if you had COVID before, can you get it again? Or does your body have antibodies so you won't need it again? If you get the vaccine, does that mean you'll have the antibodies? And then will you need another vaccine? Well, I know about the booster, but will you need another vaccine? So a lot of questions about antibodies.
Well, the most important thing when it comes to the antibodies, and this is period, everybody's skipping around, people are really not understanding the science. Antibodies is what's going to determine if you're going to ever get to herd immunity. Antibodies are produced when you get a vaccine. Your body makes B cell and T cells. We call that immunology, memory. And then when you get your booster shot, that virus, the second booster, increases your antibodies. Well, the antibodies are the most important thing when you start talking about neutralizing a virus, be it through B cell or T cells. And the reality is that what we've seen so far, and I've not seen it in any clinical immunology book. I teach this stuff. I have a master's course in infectious diseases. And I have not seen a book that says that there is conferred immunity or affinity maturation with the SARS or coronavirus. We all get the coronavirus every year. You get it, I get it. It's the second leading cause of the common cold. So you inject somebody, you're absolutely right, ma'am. You better know what the antibody level is. And that's why it's important when you have a vaccine program, you have to have a rapid antibody test, not rapid antigen test, not PCR test, because a rapid antibody test is, hey, miss, we have antibodies. 6 months now, we do a test on you, still got antibodies, and we call these antibodies neutralization antibodies. That is what binds to the virus, prevents you from having a major infection when you have a vaccine program, and that's what gets you to herd immunity. Neutralizing antibodies. Somebody else can jump in.
Okay, if there are no takers. So is there a benefit to wait a little longer? So like the iPhone, right? You get the first one, then a new one comes out and that one's better. So if you just wait, then you can get the better one later. So can we do that with the vaccine, like not get it now and wait a little while, and version 2, version 3, version 4 will be better than what we have now?
I'm going to take that. This is General Burkhead. So I don't actually know the question to that. So I'll ask Dr. Abney to take that. But what I did want to do, I wanted to make sure that before we wrap this up, and I know that some of our professionals on the line have to go, but so I did want to make sure, Dr. Abney, if you could take that last question, and I just wanted to wrap up something before our partners in the evening for us. So Dr. Abney, if you could take that.
Certainly, General, I'll be happy to take that one. Remember, we've been talking about do the math, right? And what we're seeing now, and Dr. Carter said this, as did Ms. Richmond say, we're seeing people get the vaccine. The virus. And when you look at the state of Maryland as a whole, most of our state of Maryland is in a high part of, or in a high infectivity state. There, if I remember correctly from looking at the map this morning, there are only about 2 counties that are in the low area where it's not very transmissible. So we really do need to make sure we go on and get vaccinated now, even if, and it is extremely likely, we need to have boosters later. Right now, we need to look at what's happening today. So we need to get vaccinated. And as, again, Ms. Richmond said, this is one, and Dr. Carter says all the time, this is one of my favorite things. Wear your mask, wash your hands, and watch your distance. Those are the things that are going to make a difference in whether or not you get sick now. Getting another vaccine or getting a booster later is probably going to be what's going to happen to you. But right now, you need to look at what's going to protect you and your family today or tomorrow, so that you're not one of the young people who is in the hospital, or even worse, in the ICU.
I just wanted to echo that same sentiment as I turn it back to our moderator for the evening, and just say that one of the things that you will hear me say time and time again is to please call 1-855-MD-GO-VAX to make an appointment or to get additional information, and for you as a community member to find out where you can go to get vaccine. That's what we have right now, and hopefully you can take advantage of that, and hopefully we can get to a community immunity and absolutely reduce hospitalization and deaths in our community. I appreciate all the medical professionals that have joined us this evening. Without information, you cannot make a decision. So thank you very much. And I will turn it back over to the moderator. Thank you.
Thank you, General Burkhead, and thank you again to all of our medical professionals. We have been armed with information this evening, with real information, not sugar-coated information. As Dr. Rowling has said, and Dr. Carter, that this is a marathon. It's clearly that's one of my takeaways from tonight. This is not a sprint. This is really a marathon, and we've got to be in it for the long haul as citizens. And quite sobering information when Dr. Abney just stated that only 2 counties in Maryland are at a particularly, I don't want to say safe rate, but wow, that's it's a lot. So we definitely have work to do, and hopefully as you continue and we've got information tonight, we can make better decisions and more informed decisions for ourselves and for our families and within our communities. So yes, thank you all again. We are going to wrap up and now hear closing remarks from first, President Darkeisha Moten, and second, Distinguished Pearls Foundation Chair, Tanoa Morgan. And also, there has been a question about a copy of the recording. We will work to provide that as well. President Moten.
Greetings all. I would like to take a point of privilege to acknowledge our committee leads for this evening. So Lisa Simpson-Smith, Sora Campbell, and Sora Draper. Just thank you for pulling this all together with the task force and the health departments, and thank you all for joining in tonight. I am very proud to be a member of Zeta Phi Beta Sorority Incorporated and to support our 501c3, the Distinguished Pearls Foundation, and what they're doing as service to Prince George's County. So thank you again. Great moderating tonight, Sora Campbell, and I will turn it over now to our Distinguished Pearls Foundation Chair, Sora Tanoa Morgan.
Thank you so much, Sora Moten, Madam President. This has just been a wonderful, wonderful conversation, and I am just blown away by all the information that was shared. Just the quality of this event has been absolutely fantastic. So I did want to take a moment and thank everybody who was involved in bringing this together, from the state level to the local level. My friends, I hope that you got your questions answered. I hope you got good, solid information to share with your communities, so that, as one of our speakers noted, we can help meet people where they are, help address their concerns, and help them focus on the why. I know none of us wants to spend our next holiday season on Zoom. So thank you to the Vaccine Equity Task Force, our county health leaders, all the speakers today. Also to the members of the committee that did work to bring this together. Thank you so very much. They did a lot of work behind the scenes, and it was a supersized task. I feel like they did a phenomenal job. Folks, if you haven't been vaccinated, I encourage you to do so. Grab a friend and help them to get vaccinated as well. We look forward to doing our part as far as the Distinguished Pearls Foundation. And in fact, we will be hosting, I'm going to share my screen here for a second. We will be doing our part with our community partners by putting on a local boots on the ground event on May the 1st. We're going to be knocking on doors, we're going to be handing out literature, and we're going to be encouraging our community to get vaccinated. And we hope that you will join us by signing up tonight to receive information about this community event. You can see that the registration URL is right there in the center of your screen. We'll be revealing the event location soon, so please sign up today and keep a lookout for further information. Thank you all so much for joining us again this evening, and good night.
One other thing before we leave, we definitely have to, thank you, Tanoa. We absolutely have to recognize every member of this committee. This again was a collaborative. This again was. So we want to thank every member of this team. She's behind the scenes, but Mimi, thank you so much for being one of the driving forces in this effort for this evening. Again, General Burkhead, thank you all, every presenter, Major Perry, Major Dent, thank you all. I'm missing someone else. Major Jenkins, oh, I'm sorry, Lieutenant Colonel, pardon me, Jenkins, also Planning Committee at part of the Vaccine Equity Task Force. Thank you, thank you, thank you all so very much.
There's actually one other picture. There you go.
Yes, and also Dr. Abney and Miss Linda Warren from Charles County Health Department. Thank you all so much. I think I've covered everyone now. And so, yes, we will see some of you on May 1st and look out for that information. Have a great evening.